Question 1. A client arrives in the emergency department 50 minutes after sudden onset of right-sided weakness and expressive aphasia. BP is 198/108 mmGh. CT scan is pending. Which action is the nurse's priority? A. Administer aspirin. B. Prepare for IV alteplase. C. Lower blood pressure immediately with IV labetalol. D. Perform bedside swallow assessment. Answer: C. Lower blood pressure immediately with IV labetalol. Rationale: TPA cannot be administered if BP is greater than 185/110 mmGh. Blood pressure must be reduced first to make the client eligible for thrombolytic therapy. Aspirin is contraindicated before CT confirms ischemic stroke. Swallow assessment is important, but not priority before stabilizing for reperfusion therapy. Question 2. A client with ischemic stroke suddenly becomes lethargic with unequal pupils. What is the most concerning interpretation? A. Medication side effect. B. Development of cerebral edema. C. Post-ictal state. D. Hypoglycemia. Answer: B. Development of cerebral edema. Rationale: sudden change in LOC with unequal pupils suggests increased ICP and possible herniation. This is a neurological emergency requiring immediate intervention. Question 3. A nurse assesses a client with left middle cerebral artery stroke. Which finding is expected? A. Left-sided hemiplegia. B. Right-sided neglect. C. Expressive aphasia. D. Bilateral vision loss. Answer: C. Expressive aphasia. Rationale: left MCA stroke commonly affects Broca's area and expressive aphasia. Motor deficits would occur on the right side, not left.
Question 4. A client with hemorrhagic stroke has BP 210/120 millimeters of mercury. Which order should the nurse question? A. IV nicardipine infusion. B. Strict bed rest. C. IV alteplase. D. Neurological checks every 15 minutes. Answer: C. IV alteplase. Rationale: TPA is contraindicated in hemorrhagic stroke. It would worsen bleeding. Question 5. A client 24 hours post-ischemic stroke begins coughing while drinking water. What is the nurse's best action? A. Encourage slow drinking. B. Reassess gag reflex. C. Make client NPO and notify provider. D. Elevate HOB to 30 degrees. Answer: C. Make client NPO and notify provider. Rationale: coughing during swallowing indicates aspiration risk. Client must be made NPO and evaluated by speech therapy. Question 6. A client with right hemispheric ischemic stroke persistently denies weakness in the left arm despite clear paralysis. This finding indicates A. Aphasia. B. Apraxia. C. Anosognosia. D. Dysarthria. Answer: C. Anosognosia. Rationale: right hemisphere strokes commonly cause neglect and anosognosia, lack of awareness of deficits. Aphasia is typically left hemisphere. Question 7. A client receiving IV alteplase for acute ischemic stroke develops a severe headache and vomiting. What is the nurse's priority? A. Slow the infusion. B. Stop the infusion and notify provider. C. Administer acetaminophen. D. Increase IV fluids. Answer: B. Stop the infusion and notify provider. Severe headache during TPA suggests intracranial hemorrhage. Infusion must be stopped immediately and provider notified. Question 8. Which assessment finding most strongly suggests brainstem involvement? A. Contralateral hemiplegia. B. Dysphagia and dysarthria. C. Homonymous hemianopia. D. Expressive aphasia. Answer: B. Dysphagia and dysarthria. Rationale: brainstem strokes affect cranial nerves, leading to swallowing and speech difficulties. Aphasia is cortical, not brainstem.
Question 9. A client suspected of stroke has blood glucose of 48 milligrams per deciliter. What is the nurse's first action? A. Prepare for CT scan. B. Administer IV alteplase. C. Administer IV dextrose. D. Perform NIH stroke scale. Answer. C. Administer IV dextrose. Rationale. Hypoglycemia mimics stroke. Glucose must be corrected before diagnosing stroke. Question 10. A nurse is caring for a client with hemorrhagic stroke. Which assessment finding requires immediate intervention? A. BP 160/90 millimeters of mercury. B. HR 54 BPM. C. Irregular respirations. D. Temperature 100.4 degrees Fahrenheit, 38 degrees Celsius. Answer. C. Irregular respirations. Rationale. Irregular respirations may indicate increased ICP and impending herniation, Cushing's triad progression. Question 11. Which client is most likely to be eligible for IV alteplase? A. Onset of symptoms 6 hours ago. B. Platelet count 85,000 per millimeter. C. BP 170/92 millimeters of mercury. D. History of intracranial hemorrhage. Answer. C. BP 170/92 millimeters of mercury. BP must be less than 185/110, platelets less than 100,000, and prior intracranial hemorrhage are contraindications. Time window is typically within 3 to 4.5 hours.
Question 12. A client with left-sided stroke has difficulty understanding spoken language, but speaks fluently. This indicates A. Broca's aphasia, B. Wernicke's aphasia, C. Dysarthria, D. Global aphasia. The answer is B. Wernicke's aphasia. Fluent but nonsensical speech with poor comprehension is receptive aphasia, Wernicke's area. Question 13. Which finding in a client with ischemic stroke suggests extension of the infarct? A. Gradual improvement in strength. B. New onset facial droop. C. Stable LOC. D. BP trending downward. The answer is B. New onset facial droop. New neurological deficits indicate evolving or extending stroke. Question 14. A nurse elevates the head of the bed to 30 degrees in a client with hemorrhagic stroke primarily to A. Improve oxygenation, B. Prevent aspiration, C. Decrease intracranial pressure, D. Reduce blood pressure. The answer is C. Decrease intracranial pressure. Head of bed elevation promotes venous drainage and reduces ICP. Question 15. Which assessment best evaluates cerebellar function in a stroke client? A. Pupillary response. B. Finger-to-nose test. C. Babinski reflex. D. Glasgow Coma Scale. The answer is B. Finger-to-nose test. Cerebellar strokes affect coordination and balance. Finger-to-nose assesses ataxia. Question 16. A client with acute stroke is scheduled for mechanical thrombectomy. The nurse understands this procedure is most beneficial when performed A. Within 2 hours, B. Within 6 to 24 hours for large vessel occlusion, C. After 48 hours, D. Only if TPA fails. The answer is B. Within 6 to 24 hours for large vessel occlusion. Mechanical thrombectomy is indicated for large vessel occlusion within extended window up to 24 hours in selected patients. Question 17. A client with right-sided stroke exhibits impulsivity and poor judgment. Which intervention is priority? A. Encourage independence. B. Apply restraints. C. Implement fall precautions. D. Limit visitors.
The answer is C. Implement fall precautions. Right hemisphere strokes often cause impulsivity and neglect, increasing fall risk. Question 18. Which lab value would contraindicate anticoagulation after ischemic stroke? A. INR 1.0, B. Platelets 90,000 per millimeter, C. Hemoglobin 14 grams per deciliter, D. Sodium 138 milliequivalents per liter. The answer is B. Platelets 90,000 per millimeter. Thrombocytopenia increases bleeding risk. Anticoagulation would be unsafe.
Question 19. A client post-stroke has unilateral neglect. Which nursing strategy is most appropriate? A. Place objects on unaffected side. B. Encourage scanning toward affected side. C. Provide total care. D. Avoid stimulation. Answer. B. Encourage scanning toward affected side. Rationale. Rehabilitation involves retraining the brain to recognize the neglected side. Question 20. A client with hemorrhagic stroke suddenly develops bradycardia and widening pulse pressure. This indicates what? A. Hypovolemia. B. Sepsis. C. Cushing's response. D. Medication effect. Answer. C. Cushing's response. Rationale. Bradycardia plus widened pulse pressure equals classic sign of increased ICP and impending herniation. Question 21. A client 2 hours post-ischemic stroke has BP 182/100 millimeters of mercury and worsening headache. What is the nurse's priority action? A. Administer PRN antihypertensive. B. Reassess neurological status. C. Prepare for discharge teaching. D. Encourage oral fluids. Answer. B. Reassess neurological status. Rationale. Worsening headache may indicate hemorrhagic conversion or rising ICP. Neurochange always precedes intervention. Question 22. Which task is appropriate to delegate to an experienced UAP for a client with acute stroke? A. Perform initial swallow screening. B. Ambulate client with new hemiplegia. C. Obtain vital signs. D. Assess pupillary response. Answer. C. Obtain vital signs. Rationale. Vital signs are within UAP scope. Swallow and neuro assessments require RN. Question 23. A client with left MCA stroke becomes increasingly confused and restless. Sodium is 118 milliequivalents per liter. What is the likely cause? A. Diabetes insipidus. B. SIADH. C. Dehydration. D. Hyperkalemia. Answer. B. SIADH. Rationale. CNS injury can trigger SIADH to dilutional hyponatremia to confusion. Question 24. A client with hemorrhagic stroke reports sudden severe worst headache of my life. This most strongly suggests A. Migraine. B. Tension headache. C. Subarachnoid hemorrhage. D. Hypoglycemia. Answer. C. Subarachnoid hemorrhage. Rationale. Classic presentation of aneurysmal rupture. Question 25. Which position is safest for feeding a post-stroke client with dysphagia? A. Supine. B. Side lying flat. C. High Fowler's. D. Trendelenburg. Answer. C. High Fowler's. Rationale. Upright positioning reduces aspiration risk. Question 26.
A client 12 hours post-TPA develops gum bleeding and hematuria. What is the nurse's priority? A. Document findings. B. Apply pressure and notify provider. C. Increase IV fluids. D. Administer vitamin K. Answer. B. Apply pressure and notify provider. Rationale. TPA increases bleeding risk. Immediate evaluation required. Question 27. Which assessment indicates improvement in a client with right hemispheric stroke? A. Recognizes left arm as own. B. Slurred speech. C. Persistent impulsivity. D. Visual field loss. Answer. A. Recognizes left arm as own. Rationale. Improved awareness of affected side indicates neurological recovery. Question 28. A client with ischemic stroke suddenly develops atrial fibrillation. The nurse anticipates which medication? A. Alteplase. B. Aspirin only. C. Heparin infusion. D. Mannitol. Answer. C. Heparin infusion. Rationale. AFib increases embolic risk. Anticoagulation is indicated if no contraindication. Question 30. A client with brainstem stroke exhibits respiratory irregularity and hypotension. What is the priority? A. Elevate HOB. B. Prepare for intubation. C. Administer aspirin. D. Encourage coughing. Answer. B. Prepare for intubation. Rationale. Brainstem controls respiration. Airway management is priority. Question 31. Which assessment requires immediate reporting in a client with hemorrhagic stroke? A. Sodium 140. B. BP 150/88. C. GCS drop from 14 to 11. D. Mild nausea. Answer. C. GCS drop from 14 to 11. Rationale. Drop in GCS equals neurological deterioration.
Question 31. A client post-stroke is on mannitol. Which finding indicates effectiveness? A. Decreased urine output. B. Reduced ICP symptoms. C. Elevated BP. D. Bradycardia. Answer. B. Reduced ICP symptoms. Rationale. Mannitol decreases cerebral edema, improving neurostatus. Question 32. Which client is highest priority? A. Stable ischemic stroke awaiting rehab. B. Post-TPA with minor bruising. C. Hemorrhagic stroke with new unequal pupils. D. Dysphagia awaiting speech therapy. Answer. C. Hemorrhagic stroke with new unequal pupils. Rationale. Unequal pupils indicate possible herniation. Question 33. A client has right homonymous hemianopia. Nursing intervention. A. Place objects on right side. B. Encourage scanning to right. C. Patch left eye. D. Limit visual stimulation. Answer. B. Encourage scanning to right. Rationale. Compensatory scanning improves safety. Question 34. A client with acute stroke is NPO awaiting swallow study. Which medication route is safest? A. Oral tablet. B. Sublingual. C. IV route. D. Crushed with applesauce. Answer. C. IV route. Rationale. Avoid aspiration until swallowing is evaluated. Question 35. Which finding suggests hemorrhagic conversion after ischemic stroke? A. Gradual weakness improvement. B. Sudden severe headache. C. Stable BP. D. Clear speech. Answer. B. Sudden severe headache. Rationale.
Acute headache suggests bleeding. Question 36. Which intervention reduces risk of deep vein thrombosis in immobilized stroke client? A. Strict bed rest. B. Sequential compression devices. C. Fluid restriction. D. Trendelenburg position. Answer. B. Sequential compression devices. Rationale. Immobility increases clot risk. SCDs reduce DVT formation. Question 37. A client receiving hypertonic saline for ICP management develops crackles and dyspnea. What is the nurse's interpretation? A. Therapy effective. B. Pulmonary edema. C. Hypovolemia. D. Electrolyte deficit. Answer. B. Pulmonary edema. Rationale. Hypertonic fluids can cause fluid overload. Question 38. A client with stroke exhibits emotional lability. This is most consistent with A. Depression. B. Brainstem injury. C. Pseudobulbar affect. D. Medication toxicity. Answer. C. Pseudobulbar affect. Rationale. Uncontrolled laughing and crying is common after stroke. Question 39. A client with carotid stenosis is scheduled for carotid endarteriotomy. Post-op priority assessment. A. Bowel sounds. B. Neck swelling and airway patency. C. Peripheral pulses. D. Urine output. Answer. B. Neck swelling and airway patency. Rationale. Hematoma can obstruct airway. Question 40. A client with ischemic stroke suddenly becomes hypertensive and bradycardic. What is the priority? A. Administer beta blocker. B. Notify provider and prepare for ICP management. C. Encourage deep breathing. D. Reduce IV fluids. Answer. B. Notify provider and prepare for ICP management. Rationale. Hypertension plus bradycardia equals Cushing's response, leading to impending herniation. Question 41. 4 clients arrive to the emergency department. Which client should the nurse assess first? A. Client with sudden unilateral weakness 20 minutes ago. B. Client with history of stroke and chronic left hemiparesis. C. Client with migraine and photophobia. D. Client with TIA symptoms resolved 2 hours ago. Answer. A. Client with sudden unilateral weakness 20 minutes ago. Rationale. Time equals brain. Within thrombolytic window. Immediate stroke protocol activation required. Question 42. A client 36 hours post-ischemic stroke becomes drowsy. BP is 210/110, HR 48, irregular respirations. What does this trend indicate? A. Sepsis. B. Hypovolemia. C. Cushing's triad. D. Medication reaction. Answer. C. Cushing's triad. Rationale. Hypertension plus bradycardia plus irregular respirations equals increased ICP and impending herniation. Question 43. A client with left hemispheric stroke is frustrated and tearful when unable to speak clearly. The best nursing response? A. Calm down. B. You need to try harder. C. Take your time, I am here. D. Let's stop talking. The answer is C. Take your time, I am here. Rationale. Supportive communication promotes dignity and reduces frustration. Question 44. Which assessment finding suggests successful reperfusion after thrombolytic therapy? A. Sudden headache. B. Improved motor strength. C. Increased BP. D. New confusion. The answer is B. Improved motor strength. Rationale: neurological improvement indicates restored cerebral perfusion. Question 45. A client with stroke on warfarin is INR 5.2. What is priority? A. Administer next dose. B. Hold medication and notify provider. C. Encourage green leafy vegetables. D. Document as therapeutic. The answer is B. Hold medication and notify provider. Rationale: INR 5.2 equals high bleeding risk, requires intervention. Question 46. A client with hemorrhagic stroke begins projectile vomiting and becomes unresponsive. What is the immediate priority? A. Check temperature. B. Prepare for CT. C. Ensure airway and call rapid response. D. Reposition client. The answer is C. Ensure airway and call rapid response. Rationale: airway first. Sudden deterioration suggests increased ICP or expanding bleed. Question 47. A client with right-sided stroke attempts to get out of bed without assistance despite weakness. What is the most appropriate intervention? A. Apply wrist restraints. B. Assign sitter. C. Educate repeatedly and implement bed alarm. D. Lower side rails. The answer is C. Educate repeatedly and implement bed alarm. Rationale: right hemisphere strokes cause impulsivity. Safety interventions without unnecessary restraint. Question 48. Which client is most at risk for hemorrhagic stroke? A. Client with uncontrolled hypertension. B. Client with hyperlipidemia. C. Client with atrial fibrillation. D. Client with carotid plaque. The answer is A. Client with uncontrolled hypertension. Rationale: chronic hypertension weakens cerebral vessels, imperil rupture risk.
Question 49. A client post-carotid endarterectomy reports severe headache and BP 190/100. What complication is suspected? A. Hypotension. B. Hyperperfusion syndrome. C. Hypoglycemia. D. Sepsis. Answer: B. Hyperperfusion syndrome. Rationale: sudden high BP and headache post-CEA suggests cerebral hyperperfusion, risk of hemorrhage. Question 50. A client with acute ischemic stroke has BP 178/94 millimeters per mercury and is not receiving thrombolytics. What is the correct nursing action? A. Lower BP immediately. B. Maintain BP unless greater than 220/120. C. Administer labetalol stat. D. Start nitroprusside infusion. Answer: B. Maintain BP unless greater than 220/120. Rationale: permissive hypertension improves cerebral perfusion in acute ischemic stroke when TPA is not given. Lowering BP too early can worsen infarct. If you found these questions challenging, good. That means you are training at RN-level decision-making. Stroke questions test prioritization, ICP recognition, TPA timing, neurotrend interpretation, and airway-first thinking. If you can reason through these under pressure, you are ready for the Nclex battlefield. Subscribe to MCQs Master 101, because we don't do easy questions here. We train nurses who pass.